Welcome everyone. Hello, I am Lydia, and tonight we are going to be chatting about risk factors for postpartum depression and anxiety. I want to help you identify them and offer you some tips about how to decrease your risk, and of course, offer you some resources if you or a mama you love are experiencing postpartum depression or anxiety right now. So I'm so glad you could join us, and let's dive right in. Um, I'm Lydia. I'm a wife and a mama of 5 little people, and they are ages 8 down to 4 months old. And I am also a 3-time survivor of postpartum depression and anxiety. As you can imagine, going through that so many times has really kind of impassioned me to work with other mamas who are also struggling during pregnancy or their postpartum. And so I am a proud maternal mental health advocate, and I am a volunteer with Postpartum Support International here in my state of Georgia. I'd like to share a little bit of my story with you, just briefly. As I said, am a survivor of 3 times postpartum depression and anxiety. So this happened to me after the birth of my first 3 children. And when I became a new mom, I had no idea that postpartum depression or anxiety was even a thing. I was completely uneducated. I was unscreened, unprepared, and pretty much left to manage my symptoms and my feelings all by myself. I didn't know where to turn or what to do. I was really kind of hiding my symptoms from my family, even from my husband. I thought for sure that if anyone knew what I was thinking or feeling, then they would consider me a terrible mother, a horrible person. And so I just kind of tried to hide my thoughts and my feelings until one day it became too much for me. My symptoms really just ranged from low mood to very debilitating anxiety to rage to even some suicidal thoughts. And I just couldn't work through it anymore on my own. And so I had a friend who was a psychologist, and I chatted with her one day and really kind of opened up. And she helped me to see what was going on and really encouraged me to seek professional help. You can't do this alone. She told me, you've got to see somebody who can help you. And I'm so glad I listened to her and I did that. So I did. I spoke with my doctor. I really began therapy, and with a lot of hard work in therapy and some medication and a lot of loving support from my family, my spouse, I got through to the other side and I healed. And I have actually had 2 more children since then without any postpartum depression afterwards. And so it is possible, if you're wondering, it is absolutely possible to do that. But looking back, I can see how many risk factors I had then. Of course, completely unaware and uneducated back then, but so many risk factors were stacked against me then, and I had no idea what to look for, but I want you to know. I really believe with all my heart that knowledge is empowerment. When it comes to motherhood, across the board, the more we know, the better prepared we are, the better moms we are. But it is the same with our mental health, understanding signs of mental illness. That is empowering. Understanding your risk factors and being able to identify them, that is empowering to us. So that is why I'm here. And I want to give you those tools and that power to be able to see what's going on and be prepared. So we are going to talk about those risk factors now, but before we do, I want to give you a couple of stats. So postpartum depression and anxiety affect 1 in 7 moms, and that's a big number. It's too big, and we're working to decrease that. But for those of us who've experienced it, the big question is always, why me? Why did this happen to me? What have I done wrong? Could I have prevented this? Why is it me and not the mom next door? So I want to start out by saying, first of all, you need to know that postpartum depression and anxiety or any related mental illness is not your fault. You are never to blame for that, period. Secondly, you need to know that risk factors do not cause mental illness. So I'm not here to freak you out. I am here to help you be prepared. So when we can identify them, we know what makes us vulnerable to these illnesses, then we can prepare ourselves. We can mobilize our support networks, we can find our local resources, and we can be prepared. So let's define a risk factor. A risk factor is something that increases your susceptibility to an illness. It can be an attribute, a characteristic that you have. It can be even an event or an exposure, anything that increases your vulnerability to a disease. So current research on postpartum depression and anxiety seem to indicate that these illnesses are caused by kind of a perfect storm of both nature and nurture. So what I mean by that is you may have a genetic predisposition to mental illness in the same way that you may have one to high blood pressure. So things going on inside your body help determine what happens to your mental health. So your mental health history, your family history of mental health is important there. But did you know that just as important is also your nature, your environment, the things that happen to you, events in your past or things happening now also play a big role in determining your vulnerability to these mental illnesses surrounding pregnancy and postpartum. So it's both nature and nurture. So I want to talk about some of these proven risk factors right now, and I'm going to give you a list. I'm going to go through some of them using my own experience as examples, and then afterwards I'm going to post them in the comments so that you can keep track of what we're talking about. So let me look at my notes here to make sure I don't miss anything. So first risk factor, a previous history of depression or anxiety. So in my case, I had struggled with anxiety all my life and a few depressive episodes. So right there, my nature was working against me. It was in my genes. And so that was a huge risk factor for me. Having a second risk factor, having postpartum depression or anxiety in a previous pregnancy or postpartum automatically increases risk. So once I had experienced it with my first child, my subsequent pregnancies and postpartums were at a greater risk. Number 3, a lack of social support. This is big. In my case, after the birth of my first child, we had just moved to a new town. I didn't know anyone. I didn't have family there. I didn't have friends. And I didn't have anywhere to turn. No one could tell me how to be a good mom, what was going on with my kid who cried all the time. And so I lacked a support group. And so that really made me feel isolated and alone and inadequate and unsure of myself. So my risk factors increased there. Number 4, having a high needs or a temperamental baby. So in my case, I've had a couple of very colicky children, especially with my second child. She had terrible acid reflux and cried all the time. So we weren't sleeping well. She wasn't eating well. It was very stressful. So it made me feel very frazzled and even angry that there was so much crying and I couldn't soothe it. So having a high needs baby right there increased my risk for these illnesses. Number 5, difficulty breastfeeding. That's a big one for a lot of moms. We kind of think that breastfeeding should just happen supernaturally and that all the glowing Instagram pictures will just come true for us. But breastfeeding can be hard work for a lot of moms, and it was for me, especially with my first child. He didn't have a good latch, and my milk supply was low, and he was not thriving, and the doctors were upset about it. And so I wasn't meeting my breastfeeding goals. I felt like a failure, and like I was not keeping my child alive and thriving the way that I should be. So that increased my risk. Those feelings of failure and inadequacy and frustration increased my risk significantly. Number 6, stress. What life doesn't have stress, right? Especially with kids. But certain forms of stress can really be a trigger for these postpartum illnesses. So for me, my stress took the form of lack of sleep. It does every time. It's a trigger for me every time I have a baby. Lack of sleep really negatively affected my mind and my body. So the stress on my mind and my body from so little sleep with a newborn really, I think, was what set me over the edge every single time that I became depressed during my postpartum times, and really agitated all my anxiety, the lack of sleep. There's a reason that sleep deprivation is a cause of terrible things like car accidents and all kinds of things like that. Sleep deprivation is difficult for any person, especially a new mom who's trying to deal with a newborn. Keeping a small human alive on 2 hours of sleep every night is really hard for any person. So that really increases your risk. So these 6 things were my risk factors, and they are common to many women. And as I said, I'm going to post these in the comments so that you can go back over them. But let me briefly list a few more because you deserve to know these. So let me make sure that I get them all here. A difficult pregnancy or an unwanted pregnancy, a traumatic birth, or a baby in the neonatal intensive care unit, having financial distress of any kind, childhood abuse, physical or sexual, relationship problems, if you're struggling with your spouse or your mom, or if those have been issues for you in the past. And this one might surprise you, even mom's personality can be a risk factor. And it was for me, actually. When you're a perfectionist, you are more prone to having anxiety over the chaos of life with a new baby, and when things do not work out the way that you were envisioning, and when your goals are not met, that brings more stress up in your life and more anxiety. So those are some of the most common risk factors. These are proven risk factors for making you vulnerable to postpartum depression and anxiety. So if any of these fit you right now, I would encourage you really to talk to your doctor about these right away. As I said before, knowing your risk factors, knowledge is power, and it gives you the opportunity to be prepared for whatever comes. It does not cause you to develop a mental illness, but it can help you to be prepared for whatever comes. I also want you to be aware that dads are also vulnerable to these postpartum mental illnesses as well. Postpartum depression and anxiety affect 1 in 10 dads, and their risk factors include, also like women, a history of depression or anxiety, a traumatic labor and delivery, watching their wife go through something traumatic, having a baby in the NICU, also financial distress, and also having a partner with postpartum depression or anxiety. All of these risk factors affect dads. So if you're a pregnant mom, you may be thinking right now, well, there's just so many risk factors. How in the world am I ever going to avoid them? I'm just doomed. But I want you to know you are not. You are not doomed. Now you are prepared, and there is definitely hope. You have the knowledge of what can put you at risk, and you can be prepared in a way that can help to decrease your risk. So we're going to talk about that. And if you're a postpartum mama who is suffering right now and you're nodding your head and you're saying, well, now I understand why these happened to me. I am so sorry that you were not given the tools and the education beforehand to prepare yourself, but there is hope for you. You will be well again. I will post some resources for you in our comments at the end, but know that this PPD is very treatable. Postpartum depression and anxiety are very treatable. So do not give up hope. So let's talk for a minute about some good news. I want to give you a couple tips for decreasing your risk for postpartum depression and anxiety. So if we go back to our example of being at risk for high blood pressure, so that's it. For example, that's in your genes, your genetic makeup makes you vulnerable to developing high blood pressure. So your doctor sees that you have a history of it in your family. So your doctor is going to tell you you need to modify your lifestyle or stop smoking, have a better diet, reduce your stress. You are taking intentional steps to decrease the risk that you have. You can really work towards the best possible outcome. You do not have to just resign yourself, well, my genes are bad, so I'm going to have high blood pressure forever. No, you can take intentional steps to decrease your risk. And the same goes with your mental health surrounding post-pregnancy and birth and postpartum. We can be very intentional about the steps we take to decrease our risk. So kind of like this, you've seen some proven risk factors, and now you identify the ones that are pertinent in particular to your life. So let's say like me, you had a previous diagnosis of anxiety. And now you have a colicky newborn who is having trouble breastfeeding, and nobody's sleeping through the night now. And your stress is really high. So you've got 4 risk factors right there. You've got breastfeeding difficulties, sleeping difficulties, and a history of depression and anxiety. So what can you do about that? Well, now you know your risk factors, you're prepared. Before something bad happens, you want to go ahead and take steps to surround yourself with support. So you may want to find a local mom support group. You may want to hire a lactation consultant or a pediatric sleep specialist to help you to breastfeed better and to get your baby sleeping better. You may want to go ahead and speak with your doctor about your risk factors and tell him, please help me to watch for signs of postpartum depression or anxiety, and get your partner on board with you as well. And if you're a pregnant mama, you can take action in the same way. You know your own history. You know your triggers. You've been made aware of some of the common risk factors, and now you can be prepared. So, say you're a pregnant mom who is in a new town with no support system, and you have a perfectionist personality, and so now you've identified some risk factors, and you can go ahead and locate a support group for moms. You can get your partner on board with your plans. You can go ahead and talk to your doctor, maybe let him know of your risk factors and what's going on with you, so you are prepared. So I mentioned before that I have had 2 babies now without any postpartum depression, and part of that was because I prepared ahead of time. I planned ahead of time. I know my triggers. I know what causes these things in me. And I was ready this time with a plan of action. I literally wrote down a plan and went over it with my husband. I had a doctor lined up with medication for me if I needed it. So I took the steps to really make a plan and be prepared so that whatever would come, I would be ready. And you can do the same. And I want to really encourage you, don't let fear determine the size of your family. Don't let fear of postpartum mental illness affect your choices. If you have had an illness in the past, postpartum or during pregnancy, you can hope for a better outcome this next time. Don't be afraid. You can work towards the best possible outcome by decreasing your risk, by identifying your risk factors and decreasing your risk. So I am going to be placing in our comments shortly these risk factors. I've got a risk assessment that you can fill out. It's a PDF form you can fill out. And we have also resources in the, for any of you who may be struggling right now with postpartum depression or anxiety. It is not too late for you, even though you are there right now. I just want to encourage you, you are not alone. This is not your fault. And I promise you, you can heal. I have done it, you can. We are really here for you. Postpartum Support International is here for you. Our Georgia chapter has great resources if you are local. So please check those out in the comments. And I would love to take any questions from you that you may have. I'll be sticking around a few minutes, so drop those in the comment box as well. And I really am grateful that you came tonight. I hope you learned something. I know it was quick and I was talking fast. There's a lot more that could be said, but I will give you those resources. And I want to invite you all to join us next time for our next Facebook Live. We do this every 2 weeks on Tuesdays, and I want to make sure I get you the right title. We are going to be hearing from a lactation consultant about common breastfeeding issues. Here's a risk factor: common breastfeeding issues that can lead to developing postpartum depression and anxiety. So you don't want to miss that one. That is in 2 weeks on August 14th at 9 p.m. So join us then, and please share this video with anyone that you think needs to know about these risk factors. Mamas, look out for each other. And thank you for joining us, and I'll be happy to take any questions here in just a moment. Thanks for being here. Take care. Good night.